Today's World Insight, new dangers and pitfalls in China's efforts to contain COVID-19. Straight from the nation's leading infectious disease authority, the chief epidemiologist of the Chinese CDC.
We prevented epidemic before they spread in the community. I think that's the most important strategy by contact tracing.
And finding humor in the time of coronavirus. Stand-up comedian Joe Wong tells us why laughter and happy outlook are still the best medicine. Here is our host, Tian Wei.
Hello and welcome to World Insight in Beijing. I'm Tian Wei. With Wuhan's 2-month lockdown lifted on April the 8th, China's campaign against COVID-19 moves to the next stage. The focus now is identifying and isolating asymptomatic patients, tracking their contacts, as well as testing those returning to China from overseas at the border. So how can this be efficiently carried out? I spoke with Wu Zunyou, the chief epidemiologist of the Chinese Center for Disease Control and Prevention, or known as Chinese CDC. Let's listen in. Professor Wu, welcome to CGTN. It's finally good to see you. I know you were very busy with the press conferences and all the research. So tell me about how much danger is still there for China, COVID-19, both external factors and also inside the country.
The transmission chain has broken, so it's very good to celebrate for now. However, if we look at the global epidemic trends, the number of cases continue to increase. So that creates tremendous pressure for China to prevent possible second wave. I think there are a few strategies. The first, I think the best way is still to encourage people in the country, stay in the country, because on the way for traveling maybe create a higher or more risk. So the stronger advice still stay in the country and follow the recommendations and the prevention measures in the country. That's the best. For people and returning and coming to China, we have 14 days of quarantine. And most important, I think, it's we create a coordination mechanism. So each city, for example, like Beijing, Shanghai, as a big city, they have the largest number of visitors coming back. Then we coordinate to distribute to in the different cities. That coordination can make this capacity suddenly increase. And also we advise or reduce the number of passengers coming back. All of this strategy will help us to manage these cases.
What about the so-called asymptomatic cases? Now, that has been such a debate. Earlier, there was a lot of talk about the danger there. However, recently we have seen over the past 1 week or so, experts have been toning down about these dangers. What is the latest situation?
Asymptomatic cases is very important in terms of infectious disease. We compare COVID-19 with SARS. So the virus shedding is different. In the SARS, so virus shedding reaches the highest after onset of symptoms, like 4 to 5 days after onset of symptoms. That means patient will be very infectious after they have the symptoms or they already seeking care. However, for COVID-19, patient will have the highest virus shedding even before onset of illness. That means people are infectious before they have symptoms.
Yeah.
So asymptomatic cases become very important to control the epidemic. So the number and the proportion of asymptomatic cases differs from country to country and also differs from the disease stage. And more important, the high proportion of asymptomatic cases indicate your capacity to detect early stage of cases. So when we saw high proportion of asymptomatic cases, that's a good sign because you catch them in the early stage. You catch them before they spread the virus to others. So we analyze the data. One of published the article in the United States called MMW. It's called Mobility Mortality Weekly Report in the March. They surveyed 76 people, senior people, about over 2/3 will develop or progress to symptomatic cases. In China, we also have observed this phenomenon. In one of the south provinces, we observed over 270 asymptomatic cases.
Which province is that, and
in
which stage
Guangdong.
of the pandemic?
Yeah, in the past 2 months, in the 2 months period, they observed 275 asymptomatic cases. 67% become symptomatic. So the early detection of case is very important. So if we reported a high proportion of asymptomatic case, it's a good sign. It's not a bad sign.
Professor, this is very important information. Therefore, how can we discover asymptomatic cases? What are some of the most important tools and mechanisms to do that right now here in China?
Let's go back to the 2 months ago when the outbreak occurred in Hubei. So the rest of provinces does not have the cases. Then a few cases come into the provinces or imported. Then the outbreak continued to expand into other provinces. So how these provinces prevent secondary outbreak in their province? The most important is contact tracing. Means people have exposure to the epidemic area or have close contacted with cases. They are at great risk become infected. So before they become illness, we contact them and put them in the quarantine, then we could observe them. So we prevented epidemic before they spread in the community. I think that's the most important strategy by contact tracing.
So now, Professor Wu, Hubei is already open. So how is it likely these people from Hubei, without any prejudice, by the way, to make sure they are not likely to be asymptomatic?
We must be both cautious and also we need to have confidence to control. There are a few strategies. Without a vaccine, what we did, we used the public health strategy. So we identify COVID-19 cases and separate them, put them in the hospital, and also we have a close contact tracing, identify close contactors. By all of this way, we divided people into 2 groups. People have virus or have possible risk exposed, and people stay home. After 2 weeks separation, the community have the virus. The risk of community have virus is very, very, very small. Because look at the incubation period. The average incubation period is 5 days.
Right.
The longest is about 14 days. That means if people stay at home, not go to outside, no movement, no exchange. After 14 days, self-separation in the community, there are almost no virus. All the people are healthy. If they infected before home isolation, they will develop the symptoms. If they are asymptomatic, they also after 2 weeks will be recovered. The virus will be moved from because of our immune system. So all the people are healthy. So the most challenge we find now is not in the Wuhan. Even in the Wuhan, they still have a few hundreds of cases in the hospital. They have hundreds of close contacts in the quarantine. In the community, is relatively safe compared with outside of China.
So you're suggesting that there is actually a very slim chance of asymptomatic patients going from Wuhan and other parts of Hubei to different parts of China. Is that what you're trying to indicate?
Very unlikely to have asymptomatic cases in the community.
Because the isolation already been done, right?
Yes, yes.
So multiple times of 14 days already right now.
Right. After 11 weeks, I believe, based on understanding of this epidemic, based on understanding the character of this virus and the spreading in the community, so we believe the risk in the Wuhan is very, very small.
Another thing related to this, will the population inside Wuhan during the lockdown have a better or bigger herd immunity possibility than the other parts of China?
I think the infection rate is a little bit higher than Wuhan compared with the rest of the country. However, even that, the infection rate or prevalence of infection among people in Wuhan does not achieve required herd immunity to prevent second epidemic.
What is the acquired so-called herd immunity?
The required level at least 70 to 80%. So in order to achieve that, we have two strategies. One strategy is the best if you have a vaccine available. So everybody have vaccinated.
So that's herd immunity anyway.
Yeah, then they can quickly to create herd immunity.
Yeah.
Another strategy, as in the early stage, UK proposed that you need to lost a lot of life. So that will be miserable. It's very hard to be accepted. Let the outbreak literally continue to spread in the community. You watch people dying, doing nothing. That's not acceptable.
That's not acceptable in a modern society at all.
Right.
What exactly is China's exit strategy?
I think we must still continuing the most practice in the control strategy for a while, because...
What do you mean by most practice?
Oh, that means monitor temperature and wear a mask and also monitor symptoms.
So we're still going to wear a mask?
Yeah, we still need to continue for a while. So we must be very cautious because this virus is very contagious. And after outbreak, majority of Chinese, over 90% are still susceptible. As long as one cases come in, it may produce outbreaks there. If we lost the opportunity, the cost is enormous. It's destructive damage. So we cannot pay that cost.
According to Johns Hopkins University, the confirmed COVID-19 cases worldwide are over 1.5 million already, spreading to over 200 countries and regions. Making cooperation happen among different countries is now critical. China has been actively sharing its data, lessons, and experiences in containing the pandemic to the world since the beginning. But China's goodwill sometimes has been questioned and in some cases even ignored on purpose. So what does that mean, and how would Chinese scientists make of this? I asked Dr. Wu Zhunyou, and he has got this to say. Professor Wu, China detected the virus early. China also tried to curb the outbreak early. However, there are those in different parts of the world that have been accusing China of one thing or another. What do you make of this very chaotic, mixed signals coming from all over the world?
For the global outbreak could be occurred or started in any corner of the earth. So this global pandemic, we are hit in the first time, or we are aware, but where it really start first. We do not know yet. So we still need to collect scientific information to understand. I think the challenge we faced outside accusing China, it's mainly because the blame, we do not responded vigorously enough. So that's not true. That's not true. When the outbreak occurred in the Hubei, so all the provinces in the China, they prepared well enough and to prevent the epidemic in their province. So look at the number of cases in the rest of provinces. Besides Hubei, the highest number of cases is in the Guangdong. It's still less than 1,600 cases. So if we compare with countries in the European continent, each of country, the population size overall, like provinces in the China. However, if you look at the magnitude of epidemic, the number of cases, and also you compare timeline. So epidemic hurt China earlier than the European continent. They do have sufficient time to prevent. If they do similar like provinces in the China, the European continent will have far more less cases. So I think it's the most political game try to change the attention from control epidemic to more political excuse.
Are you worried about that as a professional? Because we are still in a pandemic, and if people's attention are so much shifted away from the real issue, which is saving lives, are you worried about that?
I think we spend a lot of time to arguing this nonsense, and we need to go back to the scientific responding. We need to work hard to prevent a new infection. We need to spend our efforts to save lives. That's the right thing to do.
What about the experiences, lessons, the practices, and even models China used over the past few months? How much will they be of reference?
I think the most important is to share information timely and transparently with the world. That's very important because we are in the global. It's a global village. Even before we understand it's coronavirus, and we share the information or concerns in the early stage. And when the outbreak becomes obvious and we isolate the virus, we also shared. And when we developed a protocol for diagnosis and for prevention and control, the protocol immediately translated into English, put on the website, shared with the world.
In the world, in some media reports particularly, there has been suspicion against the Chinese statistics and data. Earlier, there were also questions about the CDC's reaction of the early outbreak in Wuhan. So, Professor Wu, are Chinese numbers trustworthy?
Be frankly, I want to tell you, the data in China is the best in the world.
Why would you say so? Is that because you're working for the China CDC? You say so?
No. After SARS outbreak, we take lessons from outbreak. Then we create a very good system called electronic, web-based, real-time data reporting. That data required all the doctors in the country, as long as you diagnose infectious disease, it's a law required, and you need to report. The first alert was issued in 2019 December, right? December 31st. Okay, even at that time, we do not know what caused this pneumonia. At this time, we shared this potential risk of outbreak with the WHO and with the rest of the world in January 3rd. Then we isolate the virus in January 7th. That means 4 days before we know the passenger, we already share that information. So after isolate the virus, we know the sequence. Then we share the sequence with WHO and with other countries in the January 10th.
But Professor, what about before December the 31st? Now the first cases, as we recount now, possibly started in early December or before that. There are debates about that in terms of professional judgment. But Professor, what about those period of time from the first case that we know now to December the 31st, during this period of time?
I think there's some mistake or misconception. Patient visit the doctor, the earliest is the late December. It's late December. Then doctor asks patients when they have the symptoms. They will recall the earliest symptom when the earliest symptom occurred. That does not mean health workers already know there's a possible outbreak there. So the earliest onset of illness, it's go back to like December 8. That also depends on the accuracy of patient's recall. So that's some, I think that two different dates make people misunderstand about this real situation.
Another thing is whether the system, the data system you earlier talked about, that professionals need to report directly to CDC through that mechanism, really worked with bureaucratic interference, because we now know, if we look back at the media reports and also some facts, that there were certain hospitals that were asking the doctors not to spread what the doctors consider as a strange pneumonia. So, Professor, from the central level of the CDC, of course you want to see all the numbers. You want to report immediacy. But there are other factors that are influencing the workability of this mechanism and the accuracy of this mechanism.
If a new virus coming like SARS, so this will be repeated because it will take time. It will take time to recognize this new virus. So as I just said, before January 7th, we do not know what are pathogens for this strange pneumonia. Even when we know the pathogen, we do not know how infectious it is at that time. So it should take time to understand the virus. It take time to understand how the virus is spreading in the human being, and is there possible transmission, or how infectious it is, what's the virulence of the virus. We do not know yet at the early stage. So it will take time.
So you are suggesting that the early outbreak is unavoidable?
Yes, I think response to this coronavirus have created the world records in the human history to respond to infectious disease. The first alert was issued in the December 31st. Then we isolated the virus just in 7 days. 7 days. No history in the medical world have created such short time. And another 4 days, diagnostic test kits was sent to Wuhan. That is January 10th, 11th. Then, in the January 20th, this new disease, Corona-19, was listed as notifiable disease. As long as put notifiable disease, then all the strategies to respond to infectious disease can be law enforced, implemented. Then we have the 23rd, the counter sanitaire for Wuhan. Just 3 weeks, we recognize on Euro epidemic, we isolate the virus, and we have diagnosis in the places. We put this disease in the notifiable disease. We have very strong action sanitaire put in the Wuhan. Only 3 weeks. That strategy create massive impact. You can conservatively estimate just in China, all the strategy prevented outbreak in the rest of provinces. How many number you prevented? We estimated it prevented 1.5 million cases. It avoided 60,000 of mortality. That's a tremendous life-saving strategy.
Thank you, Professor Wu. What a pleasure talking to you. Thank you so much for your work.
Thank you.
Wu Zunyou, Chief Epidemiologist from China CDC. You're watching World Insight, still to come on the program. Stand-up comedians face the tough job of making people laugh amid the gloom of the pandemic. Joe Wong tells us how they do it right after this break. Welcome back. You're still watching World Insight. I'm Tian Wei. They say laughter is the best medicine. Stand-up comedians are filling up the prescriptions for a dose of laughs, a welcome breather from, certainly, the coronavirus pandemic. One comic in particular, Joe Wong, has his work cut out for him. How does he find humor in the isolation and even when fighting stigma? Here's Joe, up close and personal. And now I'm joined by Joe Wong, the well-known stand-up comedian. Joe, welcome to the program.
Hi, Wei. It's an honor to be on your program again.
Great to see you again. Of course, this time
Yes,
it's very different. The pandemic is everywhere. For a stand-up comedian, what does that mean?
It's interesting because a lot of people ask me, hey, do you experience coronavirus-related racism or, something unpleasant? I said, yes, I experienced coronavirus-related racism, also SARS-related racism before. And when everybody's healthy, it's just some good old-fashioned anti-Asian racism, This is the nature of being a stand-up comedian. Because most people have a relatively smaller circle of friends and coworkers. Both stand-up comedians, we have to deal with a lot of people on a daily basis. So we actually experienced racism almost since day one when we started doing stand-up comedy. And it's just recently with the outbreak of coronavirus, people are starting to pay more attention, and there were more and more reports about it.
Yeah. From day one, in fact, Joe, when you were doing stand-up comedy, when you were not known to the rest of the world, you started with quote-unquote jokes about racism. You want to raise the awareness. So now how have things evolved, particularly this time? Stigmatization, racism, it seems to be very high, and it's so obvious these days.
It's very sad that people are sick and dying. And on top of that, Asians outside of Asia also feel the racism, and sometimes it's violence. Some people get punched, kicked. There's one Asian father and son even got slashed across the face in Texas by someone with a knife at a supermarket. It's just crazy, and it's very hard to make joke about it.
Yeah.
It's just not a laughing matter. What kind of bothered me was with this instance, some comedians that I've known for like more than 15 years started to kind of say things like, oh, if you don't like whatever happens in America, why don't you go back to China? There are a lot of those. There's people who are still defending the way people behave, which is really shocking to me. These are people I have known for 15 years. And but what I realized later on is you should really do this, like see something, say something. I know sometimes it's very hard to say to your friends or coworkers or colleagues or even your spouse and just say, hey, that's racist or that's inappropriate. But you have to say it. And after that, some people may stop being friends with you, but real friends will probably still stay friends with you.
So this is a big test, isn't it?
Oh yeah, exactly. So like this friend I had for more than 15 years, we had a little back and forth going, almost had a fight, and he was called a racist by other friends. So we took the fight in our private messages, and in the end, he actually saw my point. He said, "Oh yeah, I'm sorry, Asian community is suffering, and I appreciate that we're still friends." So, you know, you just have to speak up, especially at a time like this.
Joe, one of the things people have been talking about is as time goes on, pandemic means quarantine, staying at home, lockdowns even. So what does that mean for stand-up comedians like you? I mean, you're supposed to be out there on the stage with live audience. You interact with them. That's the nature of your trade. So how are you going to do that? How are you going to maintain your sharpness during this process?
Can't you tell I'm not that sharp anymore?
Well, by saying that, you're pretty sharp.
No. Yeah, I totally understand. For any joke to be working well and close to perfect, you really have to hone it in front of a live crowd.
Yeah.
And now it's very hard. So what we do is sometimes we do have like a Zoom comedy show.
Interesting. So tell me more about it. How is it compared to a live audience? What are some of the disadvantages? Maybe they're so clear, the disadvantages. But what about some of the advantages, if we could still find any silver lining in this? Joe, you're always the one who can find silver linings.
Yeah. That's what we're here for.
Yes, exactly.
Mr. and Mrs. Silver Linings.
Go ahead, Mr. Silver Linings.
I just noticed, Wei, you always smile. You know that's why it's always a pleasure talking to you. No matter how dark the situation is, you can always smile. You know,
we need to, right?
Really
we need to, Mr.
Exactly,
Silver Lining.
Yeah. Back to your question, the silver lining is when you do an online comedy show, people can tune in from all over the world. Sometimes when I do Instagram cast shows, I got people from like England or Canada. You know, they will tune in. Of course, they can't say anything. They can only type. You know, oh, this is funny, or have a little sticker there. You know, that's what you get. You know?
Yeah. What is the latest joke that you put out there that will get most of the stickers?
Well, no, I'm not only doing my jokes, but I also blend in a little bit activism, you know, just to make people aware of the fact that a lot of Asian Americans and Asian Canadians and Asian Europeans are getting attacked. Yeah. So they need to be careful and they need to speak up. But on the other hand, I do sometimes joke about being an at-home dad, you know. For example, sometimes I would say, okay, I think my son found out I'm unemployed right now. You know, he didn't used to know, or, you know, it's hard to cook for kids because they're too honest.
Yeah.
You know?
Absolutely.
Yeah, they don't know how to be polite. They're like, oh, Daddy, the chicken tastes like tofu. I'm like, son, that is tofu.
Yeah. But you know, being at home now for comedians like you must be a very interesting experience. I mean, of course, without performances earlier, you also stay at home sometime with your family. But this time it's going to be very different. And there are a lot of jokes, even among the common folks, about how to deal with family members on such a frequent basis. You know, we don't see each other often every day, but now we have to, 24 hours a day. So what does that mean? And how much inspiration does it provide you in a way? I hope it's inspiration.
I think sign-on sheet is important now. This time period, I'm going to be using this rule.
Okay, all right.
Yeah.
And are you sure there's nobody going to knock on your door and come in right now?
Yeah. Oh, I'm very guarded.
Right. Okay.
Stay away from my room.
Yeah.
But
so your own
honest,
territory.
I think years from now, we're going to look back and miss this time period because it's just so rare that you have an excuse to stay at home with your family. It's hard, you know, people can't go out, people lose their jobs or their wages. Yeah. But the silver lining is you probably will never get to spend this much time with your family ever in the future, So everything happens for a reason, and life is very short. So just really value every minute.
Okay.
That would be my attitude right now.
My test for you right now, Joe, since you talk about how much you enjoyed it staying at home, I mean, to a certain extent. So what more do you know about your kids? What more do you know about your wife now?
Oh, yeah.
Be careful
so
what you say. They're watching also.
Yeah, I know. So basically, I played all sorts of different games with my son, and it comes to the point that, he's 13 now, So basically, at this point, the only thing I'm better than him at is driving. He beats me at every other game now. So that's something I learned about my son. Yeah.
That's why you say you hope that nothing like this will happen again, right?
Yes. Don't remind me I'm so much worse than my son now.
Yeah. What about your beloved ones, your wife?
She's always been better than me in every aspect. So there's no surprise there. No contest there.
I think you just said something really politically correct.
Yeah,
but Joe, life has to go on, and there is a big unpredictability that we do not know how long this situation might last. So how are you dealing with this fear, uncertainty, also at the same time?
That's what a lot of people say. You have a kind of a goal. Like the goal I set for myself is trying to finish that book I started.
Yeah, tell me more about it.
Yeah, it's a book about skills in humor and how to deal with a different life situation with humor. That kind of book. It started a while ago when I was shooting a movie. Now I'm just really trying to finish it up now.
Yeah. Joe, one of the things I have a lot of respect for you is that you have been able to speak out in various circumstances in different cultures about something people are very sensitive in those cultures. In the U.S., for example, at the White House Correspondent Dinner, which so many people know about you, in other circumstances in China too. But now this is a very difficult time. I mean, on the one hand, you have earlier geopolitics we don't want to go into right now. But now you have another layer of pandemic, which is almost like a war against humanity in a way. So how to remain sharp? Once again, I want to come back to that topic and keep on thinking and keep on reminding people, inspiring people, and being inspired. I am trying to find a way. I hope you can help me to also do that. Joe, tell me more about your way of finding answers to these. Joe.
It's very hard, especially during hard times. It's sometimes you feel that comedy is not enough because people are suffering, and if you just write jokes, it's not going to cut it. In response, I think comedy changes too with time. For example, before Trump took office, comedy is more just pure entertainment, at least in America. And Jimmy Fallon was really popular, but once Trump became president, Stephen Colbert's show immediately became #1 because he talks about some serious issues that people are really concerned about and even go to the street about. So with the coronavirus, it's kind of the same thing. Sometimes, when Donald Trump calls it Chinese virus repeatedly on Twitter, despite the fact that a lot of Asian Americans are getting hurt, I basically just used like foul language, and I was so angry. I kept attacking him and just used some words I can't say on television, basically. And I remember one Chinese fan was saying to me, "Hey Joe, this is not like you. You're supposed to be witty and humorous, not like this. You're not supposed to use those dirty words. Dirty words are created for situations like this." And I got a lot of likes, surprisingly. So it's just when times are tough, you probably have to go with it. That would be my only suggestion and probably experience. You just have to express your feelings at the moment, and people will go with you.
Joe Wong, It's always a pleasure talking to you. I know you've been fighting very difficult situations. Our respect and our support. Thank you so much, Joe.
Thank you so much.
Joe Wong, Chinese-American comedian, talking about his life now in quote-unquote isolation at home, while at the same time fighting with laughter against the pandemic. That's all we have for today. If you'd like to see more of our program, try to find us, World Insight CGTN, into your search engine. Check out our YouTube channel, follow us on Twitter and Facebook accounts. From me, Tian Wei, and everyone on the team, thanks for watching. Bye for now.